Hi, my name is Olivia Quimby. I'm a student nurse at the University of South Alabama, and today I will be doing my Enema checkoff. Now you'll scan the room. Okay, so upon entering the room, I would perform hand hygiene. I'm also going to verify my order with the hospital policy, and I'm also going to identify the patient by using two identifiers with my order and the patient's wristband. So today we have Mr. Jaguar Jones. His date of birth is August 25th, 1963, and Mr. Jones has an allergy to penicillin, and he has a penicillin wristband. So now I'm going to explain the procedures to the patient. I'm going to provide privacy, and I'm going to gather all equipment that I will need for this procedure, specifically the bedpan and the IV rod. So now I'm going to perform hand hygiene, and I'm going to don my goggles. So now I'm going to take my Enema bag over to the sink and prepare it for the procedure. I'm going to make sure that the enema is clamped, and it is. And I'm going to make sure that my tubes do not hit the edge of the sink, just to keep them clean. So I'm going to put 750 to 1,000 milliliters of warm water into the enema bag. And now I'm going to take the soap and pour it in the enema bag. And now I'm going to agitate the solution gently by going up and down to mix in the soap with the water. So now I'm going to prime the tubing by testing to see if it works and unclamping it, and it does. I'm going to clamp it back again. And now I'm going to hang my enema bag on the IV rod or pole. So now I'm going to don clean gloves. And now I'm going to raise the bed to a working height and lower the side rails, and then I'm going to help my patient position to the left lateral Sims position. So now I'm going to take my dominant hand and get my enema tubing. And now I'm going to take my non-dominant hand and I'm going to get the lubrication and apply it to the end of the enema tubing. So now I'm going to take my left hand and place it on my patient's hip. I'm going to instruct my patient to breathe slow and deep breaths during the procedure. Also, if the patient does have hemorrhoids, I'm going to advise them to bear down during the procedure to help facilitate the process. So now I'm going to put my left hand on the patient's hip. I'm going to spread the buttocks, and now I'm going to insert the enema tube into the rectum 3 to 4 inches. Okay, now I'm going to take my dominant hand and stabilize, making sure not to take my hand off and not to let the tubing fall out or move around. I'm going to take the enema bag and I'm going to place it beside me, and then now I would unclamp. Then I would take the enema bag and I would raise it 12 to 18 inches. And if the patient were to feel any discomfort or experience cramping, I would lower the bag and I would clamp until the patient was comfortable again, and then we would continue the process. So once all of this is drained out of the enema bag, I would set the bag down, and I'm going to gently remove the enema from the patient's rectum, and then I would discard of the bag and the tubing in the trash can, but for right now I'm going to place it over here. And so I would ask the patient to keep the enema in for 10 to 15 minutes. After this time has elapsed, then I would take my bedpan and I would help the patient position onto the bedpan. I would position the large part of the bedpan towards the buttocks and the smaller portion of the bedpan in between the towards the thighs. And so I would help the patient position again, making sure they were comfortable and they can excrete. So now I'm going to document. So I'm documenting for the type and amount of the enema, the time, how the patient tolerated the procedure. I'm also documenting the color and the amount of the return and how I left the patient at the end of the procedure. Thank you.